Hi, I'm Sanja Rozman. I'm a psychotherapist, a medical doctor, and author of 9 books about addiction. Let me tell you about my newest book. It's called Serenity: How to Recognize, Understand, and Recover from Behavioral Addictions. It's based on my 30 years of work with people in recovery from addictions, and there is all you need to know about addiction yourself. Well, with many behaviors and substances that can drive addiction, it certainly seems that there are a lot of addictions and that new ones will happen or become interesting in future. But in reality, there's only one addiction because you only have one brain. In your brain, you have certain neural circuits, and they take care so that you can feel, that you can think, that you can remember things. And all these circuits, especially those that have to do with rewarding, pleasurable experiences, are affected in addiction. So, in fact, there is only one addiction. It is a disease of these brain circuits. But many behaviors and many substances can work upon these same circuits. This is important because you may think that you stopped drinking, but you remain a smoker, or you just eat too much, or have relationship problems that are addictive. And you will think that you have stopped, that you are sober, but in fact, you are not. Well, people used to think that there are certain substances that create addiction, like nicotine, alcohol, or drugs, or even prescription drugs. But in fact, it's the behaviors that create the feeling of being numb, being high, something that changes our behavior or even our feelings about things. Those behaviors can become the substance of certain addictions. Such behaviors are, for example, gambling for money, or even playing video games too much. You know that when you play too much, then you sort of lose concept of time, you lose the feeling that you should really stop and start doing something seriously. This is how behaviors that create this dissociation from time and place and responsibility, these behaviors can be abused, and if they are abused too often, an addiction cycle is created and you are going into an addiction as a disease. Well, if you think you're addicted, first you have to be sure that you're addicted, and I advise you to get my book, Serenity, and work through the exercises in this book, and so you will be able to make to yourself a diagnosis as good as any doctor could give you, because it's all in there. Then, following the diagnosis, if you're sure, then you need to know how to make this personal recovery plan. It consists of something you need to do with your body, something you need to do with your psyche, something you need to do with your relationships, and even your spirituality. When you have this plan, you need to work it, and you need to work it diligently. And you need to find people who will support you in that, and avoid people who will try to take you out or explain to you that you don't need to do it. This is the most common question I always get whenever I have my lectures. Sometimes people who love an addict, whether they're parents or loved ones, partners, are part of the problem, not part of the solution. They try to help, but they try to help too much. So much so that they were sometimes called enablers or codependents. Of course, adult people are responsible for their behaviors, and you as a loved one, you are not responsible, and you are not able to help your loved one in a way a therapist could. You can only stop enabling them. You can set your boundaries. I don't want to live with an addict. I can't go on like that. This is what you can do. And further advice on every single way of behavior addiction you can find in my book Serenity, which is specifically written for the loved ones of addicts as a source of help. Prevention is always better than treatment, and parents do have certain capabilities to prevent their children from becoming addicted. It's not just preaching what is not good and you shouldn't do that. It is more about the way how communication in a family, what kind of communication exists. Can you communicate love, acceptance, safety in your family, or is it more distant and more problematic? Do you only praise them when they do good, or do you make them feel that they are important and good as they are? This is what a person or a parent can do, and it is proven that the relationships in the family are very important and help make the distinction between the families where people become addicts and the families who are safe enough for their children to grow into responsible adults. So, what is the take-home message? The message is addiction is a disease, a serious one, but also a curable one. You need not suffer. Please inform yourself what addiction is, make up a plan and start working it. It works if you work it. And you will find everything you need to know in my book Serenity, how to recognize, understand and recover from behavioral addictions, that can be purchased on the link below.